Neuropsychiatric aspects of traumatic brain injury. See, we understand by the topic that we are talking about brain. Okay. What has happened to the brain? There is an injury that has taken place. What is injury? It is an external physical force which leads to damage. Damage what? Damaging a particular brain area or certain brain areas. It can be a structural damage or a functional damage. Basically, it can be initially it can be a temporary damage or a permanent damage. And further, it can be a structural damage or a functional damage. Here also, structural damage or a functional damage. Understood? You need not take notes here. I'll give you the notes. Just that try to understand what we are going to deal with. So, traumatic brain injury. Brain is being damaged by an external force. Okay. Okay. So, when we are saying trauma, this trauma can be mild, moderate, or severe. Basically, the intensity of the what we say the injury. It can be either mild, moderate, or severe. And why is it important? Why is it important to classify? Because all three, this mild, moderate, severe, will have different survival consequences. Okay. Okay. And how we know that the trauma can be mild, moderate, severe? It will depend on what? It depends on your mode of injury, how the injury has taken place. Okay. If it is a high velocity crash, if it is a gunshot wound, if it is a stab wound, okay, then only we can understand the trauma is mild, moderate, or severe. And why important? Because of the survival chances are different for each. Fine. This is just the very basic that you must know and understand. And this ultimately, this trauma can lead to the most deadly consequence, which is death. So that is why this topic becomes important.